What is your experience with triage and assessing patients in an emergency department setting?
In my experience working in the emergency department, triage and patient assessment are critical components of providing effective care. I have been trained to quickly and accurately evaluate patients as they arrive, using a systematic approach to prioritize treatment based on the severity of their condition. I am proficient in the use of the triage scale to assess vital signs, symptoms, and the overall appearance of each patient, ensuring that those with life-threatening conditions receive immediate attention. One of the key aspects of triage is making rapid, yet sound, clinical decisions. I have developed strong judgment skills in determining the urgency of care needed, often under pressure, where every second counts. For instance, in cases of chest pain, stroke symptoms, or severe trauma, I promptly coordinate with a medical team to initiate critical interventions. My ability to remain calm and focused allows me to manage the stress inherent in emergency settings and to make decisions that align with best practices and the protocols of the department. In addition to my clinical skills, I emphasize effective communication during triage. I ensure that patients and their families are informed about the triage process and their expected wait times, which helps to reduce anxiety and fosters a cooperative environment. My approach to triage and assessment is comprehensive, patient-centered, and driven by a commitment to delivering the highest standard of care, even in the most challenging circumstances.
What is your experience with transferring a patient from an emergency department setting to another department?
Transferring a patient from the emergency department to another department requires a thorough understanding of the patient's condition, meticulous attention to detail, and clear communication with the receiving team. In my experience, I have managed numerous patient transfers, ensuring that each one is handled with the utmost care to maintain continuity of care and patient safety. The process begins with a comprehensive handover, where I gather and document all pertinent information about the patient, including their current status, treatment provided in the emergency department, and any ongoing concerns or needs. This includes reviewing vital signs, recent lab results, imaging studies, and the administration of medications. I make sure to clearly communicate any critical details, such as allergies, special precautions, or the need for ongoing monitoring, to the receiving department to prevent any lapses in care. Coordination is also a key part of this process. I work closely with physicians, transport teams, and the receiving department to ensure that the transfer is conducted smoothly and efficiently. This often involves confirming the availability of a bed in the receiving unit, arranging for appropriate transport methods, and preparing the patient, both physically and emotionally, for the move. I am also mindful of the importance of reassuring the patient and their family, addressing any concerns they may have, and providing them with information about what to expect in the next phase of their care. Throughout the transfer, I remain vigilant about monitoring the patient's condition, particularly if they are critically ill or unstable. I am prepared to intervene if necessary and ensure that all necessary equipment and medications are on hand during the transfer process. My goal is to ensure that the transition between departments is seamless, minimizing any risks and ensuring that the patient continues to receive high-quality care.
Explain your understanding of the different types of medical emergencies that can occur in an ER.
In an emergency room, a wide variety of medical emergencies can occur, each requiring prompt and appropriate intervention to ensure the best possible outcomes for patients. My understanding of these emergencies is grounded in both my training and hands-on experience, and I categorize them broadly into several types, including trauma-related emergencies, cardiovascular emergencies, neurological emergencies, respiratory emergencies, and other acute medical conditions. Trauma-related emergencies are common in the ER and can include injuries from accidents, falls, violence, or other physical harm. These may involve fractures, lacerations, internal bleeding, head injuries, or spinal cord injuries. Managing these cases often requires rapid assessment to stabilize the patient, control bleeding, manage pain, and prepare the patient for surgery or other advanced interventions if needed. Cardiovascular emergencies are critical and often life-threatening. Conditions such as myocardial infarction, heart attack, cardiac arrest, arrhythmias, hypertensive crises, and deep vein thrombosis with pulmonary embolism fall into this category. Immediate recognition and treatment are crucial, as these conditions can rapidly deteriorate. This often involves administering medications like thrombolytics, performing CPR, defibrillation, or coordinating with cardiology for further interventions like catheterization. Neurological emergencies include strokes, ischemic and hemorrhagic, seizures, head trauma with potential intracranial pressure, and acute neurological deficits such as those seen in transient ischemic attacks, TIAs. Time is of the essence in these cases, particularly with strokes, where the golden hour concept emphasizes the importance of early intervention to prevent long-term damage. Managing these cases involves quick diagnostic workups, including imaging and initiating treatments like thrombolytic therapy or anticonvulsants. Respiratory emergencies are another critical category and can include conditions such as acute asthma exacerbations, chronic obstructive pulmonary disease, COPD exacerbations, anaphylaxis leading to airway compromise, pneumonia, and acute respiratory distress syndrome, ARDS. Effective management involves maintaining airway patency, providing oxygen therapy, administering bronchodilators or epinephrine, and possibly intubating the patient if they are unable to breathe adequately on their own. Beyond these, the ER also handles a wide range of acute medical conditions like diabetic ketoacidosis, acute renal failure, severe infections leading to sepsis, allergic reactions, gastrointestinal bleeding, and poisoning or overdose cases. Each of these conditions requires specific interventions to stabilize the patient and prevent deterioration. In summary, the ER environment is dynamic and unpredictable, requiring a deep understanding of a wide range of medical emergencies. My approach involves quick identification, prioritization of care, and coordinated efforts with a healthcare team to deliver timely and effective treatment. This broad understanding of medical emergencies allows me to be prepared for whatever situation arises and to provide the best possible care in those critical moments.
How do you ensure effective communication between yourself and other healthcare providers in the ER?
Effective communication in the ER is vital to providing high-quality patient care, given the fast-paced and often chaotic environment. To ensure clear and efficient communication with other healthcare providers, I rely on a combination of structured communication tools, active listening, and fostering a culture of collaboration. One of the key strategies I use is the SBAR, situation, background, assessment, recommendation technique. This structured method allows me to convey critical information quickly and clearly, ensuring that my colleagues receive all necessary details in a concise and organized manner. For instance, when handing off a patient to another nurse or physician, I clearly outline the patient's current situation, relevant medical history, my clinical assessment, and any recommendations for ongoing care. This approach minimizes misunderstandings and ensures that everyone involved has a shared understanding of the patient's condition and care plan. Active listening is another essential component of effective communication. I make a conscious effort to listen carefully to my colleagues, confirming that I understand their concerns and instructions by repeating key points back to them or asking clarifying questions when necessary. This practice helps to avoid errors and ensures that I am fully aligned with the team's goals for patient care. In addition to these techniques, I prioritize regular and open communication throughout each shift. I actively participate in team huddles, where we discuss patient statuses, anticipate potential issues, and align on priorities for the shift. This collaborative approach fosters a sense of teamwork and ensures that everyone is on the same page, which is especially important when dealing with critically ill patients or high patient volumes. I also recognize the importance of nonverbal communication, such as body language and facial expressions, especially in a busy ER where verbal communication might not always be possible. I make sure to be approachable and responsive to my colleagues, signaling my readiness to assist or share information as needed. Finally, I maintain clear and accurate documentation in the patient's medical records, which is an essential form of communication with other healthcare providers. Detailed and timely documentation ensures that the next caregiver has a complete understanding of the patient's condition and the care provided, reducing the likelihood of errors or omissions. By combining structured communication techniques, active listening, collaboration, and thorough documentation, I ensure that communication in the ER is as effective and seamless as possible, which ultimately leads to better patient outcomes and a more cohesive team environment.
Describe a time when you had to make a difficult decision while caring for a patient in the ER.
One particular instance that stands out involved an elderly patient who arrived at the ER in severe respiratory distress. The patient had a history of chronic obstructive pulmonary disease, COPD, and had already been intubated multiple times in the past. Upon arrival, the patient was in acute respiratory failure And while initial interventions such as oxygen therapy and non-invasive ventilation were attempted, it became clear that these measures were not sufficient. The patient's condition was rapidly deteriorating, and intubation seemed imminent. However, during this critical moment, I reviewed the patient's chart and found a recent advance directive indicating a strong preference against further intubation or mechanical ventilation. The patient had expressed a desire for comfort care and to avoid aggressive life-sustaining measures in the event of another respiratory failure. This discovery placed me in a difficult position, balancing the instinct to intervene aggressively to save a life against respecting the patient's expressed wishes. I immediately communicated the situation to the attending physician and the rest of the care team, and we convened a brief, urgent discussion to consider the best course of action. The patient's family was also contacted, and after explaining the situation to them, they confirmed that the patient had made it clear they did not want to be intubated again. With the family's consent, we decided to honor the patient's wishes. We transitioned to palliative care, focusing on keeping the patient comfortable, managing their symptoms, and providing emotional support to the family during this difficult time. The patient passed away peacefully a few hours later, surrounded by family members. This experience was challenging because it involved making a decision that went against the instinct to perform a potentially life-saving procedure. However, it reinforced the importance of respecting a patient's autonomy and wishes, even in the face of critical illness. It also highlighted the necessity of clear communication, both within the healthcare team and with the patient's family, to ensure that the patient's care aligns with their values and desires. This situation was a poignant reminder that in healthcare, our role is not only to save lives, but also to honor the choices of those we serve, ensuring they receive the care that is most meaningful to them.
What strategies do you use to stay organized and manage competing priorities in the ER?
Staying organized and managing competing priorities in the ER is essential due to the fast-paced and unpredictable nature of the environment. To effectively handle these challenges, I rely on several strategies that help me stay focused, prioritize tasks, and deliver high-quality patient care. One of the key strategies I use is triaging my tasks, much like how patients are triaged based on the severity of their condition. I constantly assess and reassess the situation, determining which tasks require immediate attention and which can be delegated or delayed. For example, stabilizing a critically ill patient always takes precedence over non-urgent tasks, such as updating documentation or restocking supplies. This dynamic prioritization helps me allocate my time and resources effectively, ensuring that the most critical needs are addressed first. Another strategy is maintaining a detailed mental or written checklist throughout my shift. I often jot down essential tasks, patient needs, and follow-up actions as they arise. This checklist acts as a guide, helping me keep track of what has been done and what still needs attention. It's a simple but effective way to ensure that nothing is overlooked, especially when juggling multiple responsibilities. Time management is also crucial in the ER. I break down tasks into manageable segments and set time limits where possible. For example, I may allocate specific time blocks for reassessing patients, administering medications, or updating records. By structuring my time, I can keep the workflow efficient and ensure that each patient receives the attention they need without unnecessary delays. Delegation and teamwork are equally important in managing competing priorities. I collaborate closely with my colleagues, understanding that we are all part of a team working toward the same goal. I am not hesitant to ask for help when needed or to delegate tasks to other team members, such as support staff or fellow nurses, when my workload becomes overwhelming. This ensures that all patients receive timely care and that no one is working in isolation. Effective communication plays a vital role in staying organized. I make sure to communicate clearly and concisely with my colleagues about patient statuses, changes in condition, or any urgent tasks that need attention. Regular updates during team huddles or briefings help everyone stay aligned and aware of the department's priorities, which reduces confusion and overlap in responsibilities. Finally, I emphasize the importance of self-care and mindfulness during my shifts. Staying calm and composed, even during the busiest times, helps me think clearly and make better decisions. Taking short moments to breathe, hydrate, or mentally reset allows me to maintain focus and resilience throughout my shift, which is critical in such a high-pressure environment. By combining these strategies, triaging tasks, using checklists, managing time effectively, delegating, communicating, and practicing mindfulness, I can stay organized and manage competing priorities in the ER. This approach not only helps me deliver the best possible care to my patients, but also ensures that I can handle the demands of the job without becoming overwhelmed.
How do you prioritize tasks when faced with multiple urgent requests from doctors and nurses?
When faced with multiple urgent requests from doctors and nurses in the ER, prioritizing tasks becomes a critical skill to ensure that patient care remains efficient and effective. My approach to prioritization involves assessing the urgency and potential impact of each task, maintaining clear communication with the team, and staying adaptable in a rapidly changing environment. The first step in prioritizing tasks is assessing the clinical urgency of each request. I evaluate the potential consequences of delaying or addressing each task, focusing on those that are life-threatening or could lead to significant patient deterioration if not handled immediately. For instance, administering medication to stabilize a patient with a critical condition, such as a severe allergic reaction or a cardiac event, would take precedence over tasks that are important but not immediately life-threatening, like routine blood draws or updating patient charts. In addition to clinical urgency, I consider the time sensitivity of the tasks. Some tasks, while not immediately life-threatening, have strict time windows that must be adhered to for optimal patient outcomes. For example, administering thrombolytics within the critical window for a stroke patient or delivering antibiotics promptly in cases of sepsis are time-sensitive tasks that require prioritization. Clear communication with the requesting doctors and nurses is another essential aspect of my prioritization process. When faced with conflicting requests, I communicate openly with the team to clarify the relative importance of each task. This might involve quickly discussing the situation with the physicians or nurses involved, explaining the current workload, and collaboratively deciding which task should be handled first. This open dialogue ensures that everyone on the team understands the priorities and helps to prevent misunderstandings or unnecessary delays in care. Delegation is another key strategy. If I find myself overwhelmed with multiple urgent tasks, I assess which ones can be delegated to other team members. For example, I might ask a colleague to assist with a task that requires immediate attention but does not necessarily need to be performed by me, such as taking vital signs or transporting a patient. This allows me to focus on the most critical tasks that require my specific skills or expertise. Staying organized and adaptable is also crucial. I often use mental or written checklists to keep track of tasks as they arise, quickly updating and reprioritizing them as the situation in the ER evolves. This flexibility allows me to respond effectively to the dynamic nature of the ER, where new emergencies can arise at any moment, requiring a shift in focus. In summary, my approach to prioritizing tasks when faced with multiple urgent requests involves assessing clinical urgency and time sensitivity, maintaining clear communication with the team, delegating tasks when appropriate, and staying organized and adaptable. By using these strategies, I can ensure that the most critical tasks are addressed promptly, leading to better patient outcomes and a more efficient workflow in the ER.
Describe a time when you had to work with limited resources in the ER.
One challenging situation I encountered involved working during a particularly busy shift in the ER when we experienced a sudden influx of patients due to a multi-vehicle accident on the highway. The ER was quickly overwhelmed, and we found ourselves facing a shortage of both staff and essential supplies like fluids, trauma dressings, and even available beds. In this situation, managing limited resources required quick thinking, effective teamwork, and strategic decision-making. First, I immediately assessed the overall situation, identifying the most critically injured patients who needed immediate care, such as those with severe bleeding or compromised airways. Prioritizing these patients was essential, as it allowed us to allocate our limited resources to those who were in the most urgent need. With limited staff available, I worked closely with the team to ensure that everyone's efforts were focused on the highest priorities. We quickly established a makeshift triage area to assess and categorize patients based on the severity of their injuries. This allowed us to streamline the care process and ensure that the most critical cases were addressed first, even though our usual resources were stretched thin. Recognizing the shortage of supplies, I also had to be resourceful in utilizing what we had. For example, we had to improvise with available materials, using pressure bandages made from alternative dressings when trauma supplies ran low. We also shared resources between patients where appropriate, such as splitting 4 fluids between 2 stable patients to ensure that everyone received some level of care while awaiting resupply. Throughout this chaotic situation, communication was key. I kept in constant contact with the charge nurse and other team members to stay updated on the availability of resources and the status of incoming patients. We also coordinated with other departments and the hospital administration to request additional supplies and reinforcements as quickly as possible. Despite the limitations, we were able to stabilize the most critical patients and provide necessary care to those with less severe injuries. This experience reinforced the importance of adaptability, teamwork, and creative problem-solving in the ER. It also highlighted the need to remain calm under pressure and to prioritize effectively when resources are scarce, ensuring that we deliver the best possible care even in challenging circumstances.
What steps do you take to ensure accurate documentation of patient information in the ER?
In the emergency room, accurate documentation of patient information is critical for providing high-quality care and ensuring continuity across shifts and healthcare providers. To ensure accuracy, I follow a structured approach. Initially, I prioritize gathering all relevant details through comprehensive assessments and direct patient interactions. This involves actively listening to patients, their families, and any available witnesses to capture a full picture of the patient's condition. Next, I utilize electronic health record (EHR) systems meticulously. I enter data promptly and double-check for any discrepancies or errors before finalizing entries. This step is crucial in preventing any potential miscommunication or misinterpretation of patient information. In addition to entering data accurately, I consistently review and update patient records as new information becomes available or as the patient's condition evolves. This practice helps maintain the most current and precise information, which is essential for ongoing treatment and decision-making. Moreover, I collaborate closely with other healthcare professionals, including physicians, nurses, and specialists, to ensure that all relevant information is shared and accurately recorded. This teamwork enhances the quality of documentation and ensures that all perspectives and observations are considered. Lastly, I remain vigilant about adhering to confidentiality and data protection protocols, ensuring that patient information is handled securely and only shared with authorized personnel. By following these steps, I help maintain a high standard of documentation that supports effective patient care and fosters a reliable healthcare environment.